What does yolk sac tumor mean for testicular cancer? Imagine discovering a lump in your testicle and wondering what it could be. One possible diagnosis is a yolk sac tumor, which is a type of testicular cancer. It's important to understand what this means so you can seek the right care. A yolk sac tumor is a rare but serious kind of germ cell tumor that develops from cells in the testicles. It is also called an endodermal sinus tumor. These tumors are most common in young children, especially boys under 3 years old, but they can also occur in adults. When they appear in adults, they tend to be more aggressive and more likely to spread beyond the testicle. In testicular cancer, a yolk sac tumor is a malignant growth that starts from germ cells, which are the cells that normally develop into sperm. It is the most common testicular cancer in young children but is quite rare in grown men. When it does appear in adults, it often indicates a more serious disease because these tumors grow quickly and tend to metastasize, or spread, to other parts of the body. Because of this rapid growth, early detection and treatment are very important. Symptoms may be subtle at first, sometimes just a painless swelling or lump in the testicle. As the tumor grows, discomfort or pain might develop, and patients may notice a feeling of heaviness. Doctors usually diagnose yolk sac tumors through physical exams, imaging tests like ultrasound, and blood tests that measure levels of alpha-fetoprotein, a tumor marker that is often elevated in these cases. Treatment generally involves removing the affected testicle through surgery, called an orchiectomy. If the tumor has spread or is aggressive, chemotherapy is often recommended. The standard chemotherapy regimen includes drugs like bleomycin, etoposide, and cisplatin. These treatments aim to destroy remaining cancer cells and reduce the risk of recurrence. The prognosis for patients with yolk sac tumors depends on several factors, including age, stage at diagnosis, and how well the tumor responds to treatment. Early detection and comprehensive care can lead to good outcomes, especially in children. However, in adults, the disease can be more challenging, and close follow-up is essential to monitor for relapse or metastasis. In summary, a yolk sac tumor in testicular cancer indicates a malignant germ cell tumor that is most common in young children but can be more aggressive and harder to treat in adults. It underscores the importance of early diagnosis, prompt surgical removal, and appropriate chemotherapy. If you or someone you know notices any unusual testicular changes, consulting a healthcare professional promptly is crucial. Remember, advances in medical science continue to improve outcomes for those affected by this disease. Always seek personalized advice from your doctor to understand your specific situation and treatment options.